Hey guys, Dr. Heimlich here, and today we're going to be talking about low thyroid symptoms, Hashimoto's, fibromyalgia, and their connection with antacid use. Now, the majority, I would say, of our patients who come in with different chronic conditions are taking antacids. Why is that? Well, there's a lot of different reasons, partly because it could be, there's a lot of things that beat down the normal hydrochloric acid in the stomach. Stress is a big one. Use of antibiotics is another one. And I've already listed those in another one, so we're not going to go into all the list of why that can be. But what happens here is we're supposed to have a certain amount of acid in our stomach. Why? Because it digests the food, specifically proteins, but the carbohydrates helps out with the fats as well. So we need our pH to be a certain level. What happens is if we have a decrease in that hydrochloric acid production for whatever reasons, then the linings in our stomach, which isn't this thick, I'm just using it for visual, starts to get narrower, and then the cells don't produce as much of the hydrochloric acid as we're supposed to. So what does that mean? Well, that means a little valve that opens up, that lets the food into the stomach, that guy tends to get a little bit wider and a little bit bigger than what it normally should be. And then the drain down here in the stomach, that tight little junction through here, that's supposed to let the food out, it stays closed a little bit longer than what it should. So what does that mean? That means the food that's sitting in the stomach stays there longer than what normally it should stay in there. And then what happens? Well, then what happens is it starts to putrefy, it starts to break down, it starts to release other type of acids. Not hydrochloric acid, but other acids. And as it releases those acids, it causes irritation to the stomach lining because the stomach lining has gotten thinner because it hasn't had its hydrochloric acid in there to keep it thick. So it irritates the stomach lining, and then what happens? Well, it kind of refluxes back up through that little hole in the top, right? It comes back up into there and can cause some acid reflux. And this is when you go to your doctor and say, hey doc, I've got some acid reflux. The doctor says, okay, let's take some antacids. Antacids come down, and you take those to help to decrease the acid in your stomach. And then you stay on those for what? Forever? A lot of times that's the case. And sometimes those are contraindicated with other type of medications that you may need to take. And I realized that sometimes I had a patient in here with peripheral neuropathy, and that was just the case. And unfortunately, I had him go to, showed him both websites from both of the companies, said, you're not allowed to take these together. Went to his doctor, and his doctor said, hey, new research came out. You're allowed to take them together. Really? So he came back and told me that. So we went ahead and I looked on the internet and showed him again where the manufacturers of both of those drugs still said not to take it. I told him, hey, you better stick with that cardiologist because that's the smartest guy around. They know the research better than even the companies do. Well, of course, that was hogwash. You've got to be careful, guys out there. You've got to do your due diligence whenever you're taking this type of stuff. The point is there's a different way to do it. Okay, there's a different way. So if we don't have that hydrochloric acid in our system as much as we're supposed to, doesn't it make sense to try and get a little bit more of that hydrochloric acid in there so that that hole at the top, that sphincter, stays a little bit tighter so it doesn't reflux back up, and the one down here starts to open up and let all the food drain out back the way it's supposed to? And I know it sounds counterintuitive. It's like, well, gosh, but I have acid in indigestion. Won't that acid? Well, it's a different type of acid. Whenever you talk with a doctor who knows what I'm talking about, they'll concur and they'll let you know exactly what I'm saying is 100% fact. So what you can do is you can actually get the lining of your stomach to increase, start it to produce more of the hydrochloric acid for you, and get your body to heal itself back up the way it was designed to heal itself back up, as opposed to robbing Peter to pay Paul by taking antacids for an indefinite period of time. So if you're taking antacids, you know the different ones that from on TV, whether it's prescribed or Tums, things like that, what you need to do is you need to find a doctor who knows what we just talked about and help yourself and look at different ways of getting your body to get itself to heal back up.